please? Check the nervous system. So to warm up, I'd like to watch a video clip to have an overview about the nervous system. And while watching the clip, there are some questions for you to answer. You see on the screen, there are 5 questions related to the content in the video clip. What are the main functions of the nervous system? 2. How many parts does the nervous system have and what are they? 3. What are the main structures of the CNS? 4. What are the main sections of the brain? And 5. What are subdivisions of the PNH? Good. All of the 5 questions shows the main content or some details of the nervous system. Let's watch a video and find out the answers. Are you ready? Now let's begin. You can also see the questions in the chat box while watching the clip.
The great and mighty nervous system, or the brain as most of us call it. What makes this organ unique is that within it lies the ability for humans to know oneself. This feature distinguishes and sets the human species apart from the rest of creation. This ability is known as consciousness or intelligence. To begin, let's look at the primary function of the nervous system. The basic purpose is to coordinate all of the activities of the body. It enables the body to respond and adapt to changes that occur both inside and outside the body. Now, the nervous system is actually split into 2 parts: the central nervous system and the peripheral nervous system. We'll explore the peripheral later, but first, let's look at the central nervous system. The central nervous system is made up of 2 major structures: the brain and the spinal cord. As most people know, the brain is found within the cranium or skull, and there are 6 main sections among other structures within it. These 6 sections are the cerebrum, cerebellum, diencephalon, the midbrain, pons, and the medulla oblongata. The first section is the cerebrum. This is the largest section. It's divided into 2 major hemispheres, which are the right and left hemisphere. And the cerebrum is further divided into 4 lobes. These 4 lobes are the frontal, the parietal, the temporal, and the occipital. The frontal lobe is primarily responsible for reasoning and thought. The parietal is primarily responsible for integrating sensory information. The temporal is primarily responsible for processing auditory information from the ears, and the occipital is primarily responsible for processing visual information from the eyes. The second section of the brain is the cerebellum. This is the section located in the back of the head, below the cerebrum, and above the first cervical of the neck. It is responsible for muscle coordination, balance, posture, and muscle tone. The diencephalon section is found between the cerebrum and the midbrain. It contains two structures, the thalamus and the hypothalamus. The thalamus behaves much like a relay station and directs sensory impulses to the cerebrum. And the hypothalamus controls and regulates autonomic nervous system functions such as temperature, appetite, water balance, sleep, and blood vessel constriction and dilation. The hypothalamus also plays a role in the emotions such as anger, fear, pleasure, pain, and affection.
Chứ còn các em cứ hiểu tiếng Việt và cộng trừ từ 1 đến 10 thành thạo là anh hướng dẫn được. Anh sẽ nói các bạn chưa bao giờ tiếng Anh dễ như thế. Ui dồi ôi anh.
The midbrain section is located below the cerebrum at the top of the brainstem. It is responsible for certain eye and auditory reflexes. The pons is located below the midbrain and in the brainstem. It is responsible for certain reflex actions such as chewing, tasting, and saliva production. And the last section is the medulla oblongata. It's the lowest part of the brainstem, and it connects with the spinal cord and is responsible for regulating heart and blood vessel function, digestion, respiration, swallowing, coughing, sneezing, and blood pressure. It's also known as the center for respiration. Now that we've covered the brain, let's take a look at the other half of the central nervous system, the spinal cord. The spinal cord is the link between the brain and the nerves and the rest of the body. The spinal cord is divided into 4 different regions: the cervical, thoracic, lumbar, and the afferent and efferent spinal nerves, which merge to form the peripheral nerves. The afferent spinal nerves are responsible for carrying information from the body to the brain. And the efferent spinal nerves are responsible for carrying information from the brain to the body. Now, within this elaborate system of nerves, neurons, and dendrites, there is a system that regulates the functions of the central nervous system, which lie outside its major components, such as the brain and the spinal cord. This system is known as the peripheral nervous system and is subdivided into 2 smaller systems: the somatic system and the autonomic nervous system. The somatic nervous system is responsible for carrying motor and sensory information both to and from the central nervous system. This system is made up of nerves that connect to the skin, sensory organs, and all skeletal muscles. The somatic system is also responsible for nearly all voluntary muscle movements, as well as for processing sensory information that arrives via external stimuli, including hearing, touch, and sight. The structures that allow this communication to happen between the nerves throughout the body and the central nervous system are known as the afferent sensory neurons and the efferent motor neurons. Now, afferent simply means conducting inward, and efferent means conducting outward. So just like in the spinal nerves, the afferent neurons take information from the nerves to the central nervous system, and the efferent neurons take information from the central nervous system to the muscle fibers throughout the body. The autonomic nervous system is further divided into the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is vital to our survival. Have you ever heard of the fight or flight response to danger? The sympathetic revs up the body when confronted with imminent danger to either defend yourself or to escape the threat. The parasympathetic nervous system is the counterbalance to the sympathetic response to danger, whether real or imagined. Once the threat is gone, the parasympathetic brings all the systems of the body back to normal. Now, at this point, you should have a basic understanding of the nervous system, but let's do a quick recap. The basic purpose of the nervous system is to coordinate all the activities of the body. It enables the body to respond and adapt to changes that occur both inside and outside the body. The two major parts to the nervous system are the central nervous system and the peripheral nervous system. The central nervous system is also divided into two major structures, the brain and the spinal cord. The brain is found within the skull or cranium, and it is made up of 6 main sections. These 6 sections are the cerebrum, cerebellum, diencephalon, the midbrain, pons, and the medulla oblongata. The other half of the central nervous system is the spinal cord, and the spinal cord is the link between the brain and the nerves and the rest of your body. The spinal cord is divided into 4 different regions: the cervical, thoracic, lumbar, and afferent and efferent spinal nerves, which merge to form the peripheral nerves. Now that we know the brain and spinal cord primarily make up the central nervous system, let's look at the peripheral nervous system. The peripheral nervous system is essentially the nervous system outside of the brain and spinal cord. The peripheral nervous system is then subdivided into 2 smaller systems called the somatic nervous system and the autonomic nervous system. So, as you can see, the nervous system is quite complex, and this is just the tip of the iceberg. Thanks for watching. Look for more videos on the nervous system at cteskills.com.
Okay, now let's see the questions after watching the clip. For question 1, can answer the question over the microphone or write down the answers in the chat box, please. What are the main functions of the nervous system? What does the nervous system do to our body? As you know, the nervous system is called the control center of our body. What does it do? Coordinate all the activities of the body, right? Just control all of the activities, coordinate all of the movements and activities of the body. That's correct. Enables the body to respond and adapt to any changes, both inside and outside the body. Yeah, okay, coordinate, adapt to the changes, both inside and outside the body. Okay. And respond, enable the body to respond to the changes and adapt them. Okay, question 2. How many parts does the nervous system have? Nervous system is subdivided into parts, and what are they? Two parts, CNS and PNS, right? Central nervous system and peripheral nervous system. Thần kinh trung ương và thần kinh ngoại biên. Right. 2 phần chính nè. Question 3. Let's talk about the CNS. What are the main structures, the main organs of the CNS? Okay, 2 main structures, the brain and the spinal cord. Brain and spinal cord. that make up the CNS or central nervous system. Não và tủy sống là hai cấu trúc chính của thần kinh trung ương. Now question 4. In terms of the brain, there are 6 main sections of the brain. What are they? Our brain is also the mystery things. So there are 6 main sections of the brain. What are they? And see the answers. Cerebrum, cerebellum, encephalon, midbrain, pons, medulla oblongata. That's correct. Good. Excellent. Cerebrum. Okay. Cerebrum, cerebellum, pons, encephalon, midbrain, pons, medulla oblongata. We'll look into more details of these sections in the reading text. Then the last one, the PNS, peripheral nervous systems. What are the subdivisions? Question 5. The PNS is also subdivided into 2 parts, somatic nervous system or SNH and autonomic nervous system ANH. Somatic nervous system hay thần kinh soma and autonomic nervous system hay thần kinh tự động. Okay, yes, that's good. Okay, one more question. Question 6, right? The ANH, autonomic nervous systems, also have 2 subdivisions, referred to as the fight or flight, rest and digest. So what are they? What is the name of the 2 subdivisions of the ANH? Autonomic nervous system. Also has 2 subdivisions. It refers to any reactions of the body that respond to the changes or any stimuli from the outside. Fight or flight, rest or digest. So what's the names of the 2 subdivisions of the ANH? Sympathetic and right, sympathetic and parasympathetic nervous system. That's correct. Thank you. Good. Sympathetic nervous system, fight or flight reactions, and parasympathetic nervous system, rest and digest reactions in the body. Okay, that are some of the main ideas of the video clip and also in the reading passage. Now let's look into details or more information in the reading passage. Now, first of all, look at the vocabulary in the textbook first. Okay, look at part A, helpful vocabulary on page 86. Okay, listen to the recordings, the pronunciation of these vocabularies in the textbook.
1. Action potential, an electrical impulse generated along a neuron's membrane. 2. Arachnoid mater, the middle layer of the meninges surrounding the brain and spinal cord. 3. Autonomic nervous system, the part of the nervous system that controls involuntary body functions. 4. Axon, the long fiber of a neuron that conducts impulses away from the cell body. 5. Basal ganglia, clusters of neurons deep within the brain involved in movement control. 6. Cerebellum, the brain region responsible for coordination, balance, and fine motor movement. 7. Cerebrospinal fluid, a clear fluid that cushions, nourishes, and protects the brain and spinal cord. 8. Cerebrum, the largest part of the brain responsible for higher cognitive functions. 9. Depolarization, a change in membrane potential that makes the inside of a cell less negative. 10. Diencephalon, brain region that includes the thalamus and hypothalamus. 11. Gray matter, neural tissue containing cell bodies and dendrites. 12. Hypothalamus, a brain structure that regulates hormones, temperature, hunger, and autonomic functions. 13. Meninges, the protective membranes covering the brain and spinal cord. 14. Motor output, the nervous system's response sent to muscles or glands. 15. Myelinated fibers, nerve fibers covered with a myelin sheath for faster impulse conduction. 16. Neuroglia, supporting cells that protect, nourish, and assist neurons. 17. Neuron, the basic functional cell of the nervous system that conducts impulses. 18. Sensory input, information received from sensory receptors about internal or external conditions. 19. Spinal cord, the major nerve pathway connecting the brain with the body. 20. Odd synapse, the junction between two neurons where signals are transmitted.
Look at the meaning of these vocabularies again and practice saying the words correctly. Pay attention to the pronunciation. Action potential. Arachnoid matter. Autonomic nervous system. Axon. Basal ganglia. Cerebellum. Cerebrospinal fluid. cerebral, depolarization, diencephalon, gray matter, hypothalamus, meninges, motor output, myelinated fibers, neuralgia, neuron, sensory input, spinal cord, synapse. Okay, now listen again and practice yourself.
One, action potential, an electrical impulse generated along a neuron's membrane. 2. Arachnoid motor, the middle layer of the meninges surrounding the brain and spinal cord. 3. Autonomic nervous system, the part of the nervous system that controls involuntary body functions. For axon, the long fiber of a neuron that conducts impulses away from the cell body. 5. Basal ganglia, clusters of neurons deep within the brain involved in movement control. 6. Cerebellum, the brain region responsible for coordination, balance, and fine motor movement. 7. Cerebrospinal fluid, a clear fluid that cushions, nourishes, and protects the brain and spinal cord. 8. Cerebrum, the largest part of the brain responsible for higher cognitive functions. 9. Depolarization, a change in membrane potential that makes the inside of a cell less negative. 10. Diencephalon, brain region that includes the thalamus and hypothalamus. 11. Gray matter, neural tissue containing cell bodies and dendrites. 12. Hypothalamus, a brain structure that regulates hormones, temperature, hunger, and autonomic functions. 13. Meninges, the protective membranes covering the brain and spinal cord. 14. Motor output, the nervous system's response sent to muscles or glands. 15. Myelinated fibers, nerve fibers covered with a myelin sheath for faster impulse conduction. 16. Neuroglia, supporting cells that protect, nourish, and assist neurons. 17. Neuron, the basic functional cell of the nervous system that conducts impulses. 18. Sensory input, information received from sensory receptors about internal or external conditions. 19. Spinal cord, the major nerve pathway connecting the brain with the body. 20. Synapse, the junction between two neurons where signals are transmitted.
Okay, now let's look at the reading message and listen to recordings of the whole reading text.
Physiology. Chapter 6. Nervous System. Medical Overview. The nervous system constitutes the most highly specialized and complex organ system in the human body, responsible for detecting internal and external stimuli, integrating information, and coordinating precise and rapid responses essential to life. Together with the endocrine system, it maintains homeostasis, yet it surpasses endocrine regulation in speed and spatial specificity. The system can be anatomically divided into the central nervous system, comprising the brain and spinal cord, and the peripheral nervous system, which includes cranial and spinal nerves and their branches. Functionally, the nervous system encompasses sensory input, integrative processing, and motor output, enabling perception, thought, movement, visceral regulation, and higher cognitive functions such as language, memory, and executive control. Anatomy. At the cellular level, the system is composed of neurons and supporting neuroglia. Neurons represent the fundamental signaling units specialized for the generation and propagation of action potentials and synaptic communication. Each neuron possesses a soma housing the nucleus, dendrites that receive incoming stimuli, and a single axon that conveys impulses toward target cells. Myelinated fibers accelerate conduction via saltatory transmission between nodes of Ranvier, whereas unmyelinated axons conduct impulses more slowly. Neuroglia, far more numerous than neurons, provide structural support, metabolic regulation, insulation, and immunological defense, a role undertaken by astrocytes, oligodendrocytes, microglia, and ependymal cells. The central nervous system is enclosed within the cranial cavity and vertebral canal, protected by three connective tissue membranes known as the meninges. The dura mater forms a tough outermost covering, the arachnoid mater lies beneath it, and the pia mater adheres directly to neural tissue. Between arachnoid and pia lies the subarachnoid space, traversed by fine trabeculae and filled with cerebrospinal fluid. The ventricular system comprises paired lateral ventricles, the third ventricle, and the fourth ventricle, all interconnected and containing cerebrospinal fluid produced chiefly by choroid plexuses. Cerebrospinal fluid supports and cushions the brain, contributes to metabolic exchange, and helps regulate intracranial pressure. The brain itself includes the cerebrum, diencephalon, brainstem, and cerebellum. The cerebral hemispheres possess gyral folds and sulcal grooves that expand cortical surface area, and they are subdivided into lobes with distinct functions. Grey matter, forming the cortex, contains neuronal soma, whereas underlying white matter contains myelinated tracts. Within the hemispheres, the basal ganglia participate in modulation of movement initiation and motor learning. The thalamus relays sensory information to cortical areas, while the hypothalamus integrates autonomic and endocrine responses. The midbrain, pons, and medulla comprise the brainstem, containing ascending sensory and descending motor pathways, cranial nerve nuclei, and vital autonomic centers that regulate respiration and cardiovascular homeostasis. The cerebellum coordinates fine movement, balance, and motor learning through intricate feedback loops. The spinal cord extends from the foramen magnum to approximately the level of the first lumbar vertebra, terminating in the conus medullaris. Its grey matter lies centrally in an H-shaped configuration, with dorsal horns containing sensory nuclei and ventral horns housing lower motor neuron bodies. Surrounding white matter contains ascending sensory and descending motor tracts. Spinal nerves emerge segmentally, each formed by dorsal sensory and ventral motor roots, and distribute to body regions to relay sensory input and motor output. The autonomic division separates into sympathetic and parasympathetic systems, operating through dual innervation to modulate visceral function. Physiology. Neuronal activity depends on membrane polarization and regulated shifts in ionic gradients. The resting membrane potential is maintained by differential permeability to potassium and by active transport via sodium-potassium ATPase. Depolarization initiated at the axon hillock triggers voltage-gated sodium channel opening, allowing rapid influx and the generation of an action potential. Propagation occurs via sequential depolarization along the axolemma, with myelin sheaths permitting saltatory conduction that significantly increases velocity. Repolarization follows through potassium efflux and restoration of ionic gradients. Synaptic transmission occurs when action potentials reach axon terminals, triggering calcium-dependent exocytosis of neurotransmitter into the synaptic cleft. Binding of neurotransmitter to postsynaptic receptors elicits excitatory or inhibitory responses depending on receptor subtype and downstream ion flux. Classical neurotransmitters include acetylcholine, dopamine, noradrenaline, serotonin, and gamma-aminobutyric acid, each serving specific CNS and autonomic functions. Chemical transmission at neuromuscular junctions employs acetylcholine for excitation of skeletal muscle fibers, whereas noradrenaline and acetylcholine mediate sympathetic and parasympathetic transmission, respectively. The CNS integrates sensory input from somatic receptors, special senses, and visceral afferents, producing conscious perception, reflex responses, and coordinated voluntary movement. Upper motor neurons originating in the primary motor cortex descend via corticospinal pathways and synapse with lower motor neurons in the spinal cord, which directly stimulate skeletal muscle. Damage to upper motor neurons results in spasticity, hyperreflexia, and loss of fine voluntary control, whereas lower motor neuron lesions cause flaccid paralysis, fasciculations, and muscle atrophy. Reflex arcs operate independently of conscious input, providing rapid responses to sensory stimuli through spinal circuits. Autonomic physiology maintains homeostasis via antagonistic sympathetic and parasympathetic outputs. Sympathetic activation increases heart rate, dilates bronchi, redistributes blood flow to skeletal muscle, and mobilizes glucose stores, whereas parasympathetic activity promotes digestion, glandular secretion, and energy conservation. Hypothalamic centers coordinate autonomic output, temperature regulation, hunger, and circadian rhythms. Pathology. Neurological disease ranges from acute life-threatening emergencies to chronic degenerative disorders. Increased intracranial pressure may arise from hemorrhage, edema, infection, or tumor, and manifests with headache, vomiting, altered consciousness, and papilledema. Traumatic brain injury may involve concussion, contusion, skull fracture, or intracranial hematoma. Extradural hematomas arise from arterial bleeding, often after temporal bone fracture, whereas subdural hematomas result from venous tearing bridging cortical surfaces, each requiring rapid diagnosis. Cerebrovascular disease represents a major clinical burden. Cerebrovascular disease represents a major clinical burden. Thromboembolic stroke produces focal neurological deficits dependent on the vascular territory affected, while intracerebral hemorrhage results from vessel rupture, often due to hypertension. Transient ischemic attacks signify temporary vascular occlusion and confer elevated risk of subsequent stroke. Dementias include degenerative processes with progressive cognitive decline, among which Alzheimer's disease predominates. Movement disorders reflect dysfunction of basal ganglia circuitry. Parkinson's disease arises from progressive loss of dopaminergic neurons in the substantia nigra, producing resting tremor, rigidity, bradykinesia, and postural instability. Demyelinating diseases such as multiple sclerosis produce disseminated lesions in CNS white matter with relapsing neurological deficits, including weakness, sensory disturbance, and visual loss due to autoimmune attack on myelin. Spinal cord pathology may involve compression, infection, trauma, or ischemia, leading to segmental loss of motor and sensory function. Peripheral neuropathies produce stocking and glove sensory loss, weakness, and impaired reflexes. Acute inflammatory demyelinating polyneuropathy, or Guillain-Barré syndrome, causes rapidly progressive ascending weakness and may compromise respiration. Bell's palsy results in unilateral facial paralysis due to facial nerve dysfunction. Developmental abnormalities such as spina bifida produce neurological deficits including paraplegia and bladder dysfunction, while hydrocephalus results from impaired cerebrospinal fluid drainage. Intracranial neoplasms originate from glial, meningeal, or vascular elements or represent metastases and present with headache, vomiting, focal deficits, or seizures. Clinical perspective. Neurology requires systematic evaluation, beginning with a detailed history focusing on onset, progression, associated symptoms, and precipitating factors. Examination assesses mental status, cranial nerve function, motor strength, coordination, tone, reflexes, and sensory modalities. Gait disturbance, dysarthria, visual field deficits, or asymmetric weakness can localize pathology within the neuraxis. Fundoscopic examination may demonstrate papilledema or papilledema, indicating increased intracranial pressure. Investigations are tailored to the suspected condition. Computed tomography rapidly detects hemorrhage and mass effect, while magnetic resonance imaging provides superior definition of soft tissue, demyelination, and posterior fossa pathology. Lumbar puncture permits analysis of cerebrospinal fluid in suspected meningitis, multiple sclerosis, or subarachnoid hemorrhage, though it is contraindicated in elevated intracranial pressure. Electroencephalography assists in seizure evaluation, and nerve conduction studies and electromyography elucidate peripheral nerve and muscle disorders. Management strategies vary widely. Acute ischemic stroke may be treated with thrombolysis or mechanical thrombectomy when indicated, whereas hemorrhagic stroke necessitates blood pressure control and neurosurgical input. Meningitis requires rapid antimicrobial therapy. Parkinson's disease is treated with dopaminergic agents, while multiple sclerosis may require immunomodulatory therapy. Neurosurgical intervention may address tumors, hydrocephalus, or compressive lesions. Supportive care, rehabilitation, and long-term monitoring form essential aspects of chronic neurological disease management.
But before going to details of the reading passage, I have a short quiz for you to test your vocabulary and some of the main ideas during the text. Write out the answers in the chat box for the sentences, please. Choose the best answer, A, B, C, or D for each sentence. From 1 to 7. From 8 to 14. From 15 to 20. Pick 20 sentences in total. Okay, now let's put the answers together. An electrical impulse generated along a neural membrane. Action potential. 2. The middle layer of the meninges. Arachnoid matter. 3. ANH, autonomic nervous system, controls involuntary body functions. 4. Axon of the neuron conducts impulses away from the cell body. 5. Basal ganglia is involved in movement control. 6. Cerebellum is mainly responsible for coordination, balance, and fine motor movement. 7. CF or cerebrospinal fluid. Fusions, nourishes, protects the brain and spinal cord. Cerebrum is the largest part of the brain, responsible for higher cognitive functions. Depolarization describes a change in membrane potential, makes the inside of the cell less negative. Transcephalon includes the thalamus and hypothalamus. 11. The gray matter contains the cell bodies and dendrites. 12. Hypothalamus regulates hormones, temperature, hunger, autonomic functions. 13. Meninges is the name for protective membranes covering the brain and the spinal cord. 14. Motor output refers to the nervous system response sent to muscles or glands. 15. Nerve fibers covered with a myelin sheath are called myelinated fibers. 16. Neuroglia support, protect, and nourish neurons. 17. Neuron is the basic functional cell of the nervous system. 18. Sensory input means information received from the sensory receptors. 19. A spinal cord is the major nerve pathway connecting the brain with the body. 20. A synapse is the junction between two neurons where signals are transmitted. Okay, let's have a look at the outlines of the reading message in your textbook. There are some main ideas. Up on the passages in the reading passage. Let's look into more details for each section. One general overview of the nervous system. Ta sẽ đi vào ý chính của từng cái tiêu đề ha. Nervous system, the most specialized and complex organ system in the human body. Và hệ cơ quan biệt hóa nhất và cũng phức tạp nhất trong cơ thể. It detects internal and external stimuli, processes information, produces rapid, precise responses. Phát hiện ra tất cả những cái kích thích bên trong và bên ngoài cơ thể. Xử lý thông tin, tạo ra những cái phản ứng, đáp ứng rất là nhanh và chính xác. Together with the endocrine system, it helps maintain homeostasis. Và cùng với hệ nội tiết, hệ thần kinh nó sẽ giúp duy trì hằng định nội môn. There are two main divisions of the nervous system. Central nervous system include the brain and spinal cord, while the peripheral nervous system contains the cranial nerves, spinal nerves, and branches. Cranial nerves, the nerves come from the cranium or the skull, and spinal nerves, the nerves originated from the spinal cord. Thần kinh sọ não và thần kinh tủy sống. Cranial thuộc về sọ, related to the skull or the cranium, and spinal nerves, thần kinh tủy sống. Some main functions of the nervous system are sensory input, tiếp nhận cảm giác, integrative processing or processing information, xử lý thông tin, tích hợp thông tin, and motor output, and produces responses, produce movements or actions. It's also responsible for perception, movement, memory, language, and higher thinking. Chịu trách nhiệm về nhận thức, về cử động, vận động, trí nhớ, ngôn ngữ, và suy nghĩ rất cao. Part 2 và cellular structure of the nervous system. Ta nói về cấu trúc hệ thần kinh. The nervous system is made up of neurons and neuralia. Neurons are the nerve cells and neuralia. Hai thành phần chính đơn vị cấu tạo cơ bản của hệ thần kinh, tế bào thần kinh đệm. Neurons are the main signaling cells. A neuron has the soma of cell body, dendrites, and axon. Cấu trúc của một neuron, còn tế bào thần kinh bao gồm có thân tế bào, soma or cell body, sợi nhánh, dendrites để tiếp nhận tín hiệu, tiếp nhận thông tin, và axon, sợi trụ để truyền xung thần kinh, truyền thông tin. Myelinated fibers conduct impulses faster through sensory conduction. Myelinated fibers mean the fibers covering the myelin sheath. Các sợi thần kinh có bao myelin, nó sẽ giúp dẫn truyền các xung thần kinh nhanh hơn thông qua cái việc dẫn truyền nhảy cốc. Neuralia support, nourish, insulate and protect neurons. Các tế bào thần kinh đệm sẽ giúp hỗ trợ, nuôi dưỡng, bảo vệ các neuron kinh. Main neural cells include astrocytes, oligodendrocytes, microglia, ependymal cells. Và tế bào thần kinh đệm thì sẽ gồm có tế bào hình sao, tế bào ít nhánh, phi tế bào đệm, tế bào nội tử. Protective structures of the CNS, những cấu trúc giúp bảo vệ hệ thần kinh trung ương. The brain and spinal cord are protected by the meninges, including the dura mater, arachnoid mater, and pia mater. Thì thần kinh trung ương gồm có tủy não và tủy sống, nó sẽ được bao bởi những cái lớp màng não gồm có màng cứng, màng nhện và lớp màng mềm. Supracranial space contains cerebrospinal fluid, CSF. Khoang dưới nhện thì sẽ chứa dịch não tủy. CNF cushions the brain, supports metabolic exchange and helps regulate intracranial pressure. Dịch não tử sẽ giúp bảo vệ não, hỗ trợ thức cái thay đổi về trao đổi chất và giúp kiểm soát áp lực não sợ. Intracranial pressure. The ventricular system contains and circulates CNH. Four, main parts of the brain and their functions. The brain includes cerebrum. Diencephalon includes the thalamus and hypothalamus, brainstem, and cerebellum. And each part has specific functions. For example, cerebrum is responsible for higher cognitive functions. Đại não sẽ chịu trách nhiệm chính về những cái chức năng về nhận thức cao, nhận thức bậc cao. Gray matter contains neuronal cell bodies, and white matter contains myelinated tracts. Benzogenia is in charge of the movement initiation and motor learning. Chất xám chứa thân tế bào thần kinh, chất trắng thì chứa các bó sợi thần kinh. Có bao myelin. Hạt nền có nhiệm vụ là khởi phát vận động và học các vận động. Transcephalon responsible for sensory relay, autonomic, endocrine control and homeostasis. Gian não thì sẽ truyền cảm giác, truyền các thông tin tín hiệu về cảm giác. Kiểm soát thần kinh tự chủ và nội tiết và duy trì cân bằng nội môi. Thalamus is for sensory relay center and hypothalamus is used for autonomic and endocrine control. Vùng đô thị là vùng trung tâm chuyển tiếp cảm giác, còn vùng dưới đồi là kiểm soát hoặc điều hòa thần kinh tự chủ và nội tiết. Brainstem. Brainstem is very essential and vital centers for respiration, cardiovascular function. Cerebellum. It's in charge of balance, coordination, and fine mood. Thân não nó là trung tâm rất là quan trọng và sống còn cho hô hấp và chức năng hô hấp và tim mạch. Triệu não thì giúp giữ thăng bằng, phối hợp các vận động hoạt động, điều khiển các cử động và vận động nhỏ và tinh tế. Structure and function of the spinal cord and PNH. The spinal cord carries sensory, motor information between the brain and the body. Gray matter is central and arch-shaped, including the dorsal horns and ventral horns. Tủy sống nó sẽ là truyền những cái tín hiệu hoặc là thông tin về cảm giác và vận động. Đến và đi từ não. Và tủy sống nó cũng có chất xám nằm ở giữa và có dạng hình chữ H hoặc là gọi là hình bướm. Mình tưởng tượng là hình bướm này sẽ có cánh gọi là sừng, dorsal horns, sừng sau và sừng trước, ventral horns. Dorsal horns include the sensory nuclei and ventral horns contains the lower motor neuron cell bodies. Sừng sau thì có chứa nhân cảm giác, sừng trước chứa các thân tế bào neuron ở dưới. Và sừng sau chủ yếu là những cái xử lý những cái thông tin về cảm giác, sensory, sensation. Còn sừng trước là xử lý những thông tin về vận động, movement, còn motor. Spinal nerves are formed by dorsal sensory roots and ventral motor roots. Các dây thần kinh tủy sống được hình thành bởi các rễ sau cảm giác và rễ trước vận động. The PNH or peripheral nervous system includes the somatic nervous system, SNH, or autonomic nervous system, ANH. And the two subdivisions of the ANH is sympathetic division, hệ giao cảm, một thần kinh giao cảm, hoặc là parasympathetic division, hệ thần kinh phối giao cảm. Physiology. Physiology of the nerve impulse transmission. Ta xem về cơ chế truyền xung thần kinh nào. Neuronal activity depends on the membrane polarization, ionic gradients. Resting membrane potentials maintain mainly by potassium permeability and sodium potassium ATPase. Depolarization triggers the action potential. Repolarization restores the membrane state. And myelin increases conduction speed. Thì hoạt động thần kinh nó sẽ phụ thuộc vào sự phân cực màng và chênh lệch nồng độ ion. Điện thế nghỉ hoặc điện thế màng nghỉ được duy trì chủ yếu bởi tính thấm của ion kali và bơm natri kali ATPase. Khử cực sẽ kích hoạt điện thế hoạt động. Tái cực sẽ khôi phục lại trạng thái màng tế bào. Bao myelin sẽ làm gia tăng hoặc là tăng tốc độ truyền của xung thần kinh. At the synapse, neurotransmitters are released into the synaptic cleft. Tại khe synapse thì các chất dẫn truyền thần kinh nó sẽ được phóng thích ra vào khe synapse để giúp dẫn truyền các tín hiệu từ neuron này qua neuron khác đó. Và một số những cái chất dẫn truyền thần kinh quan trọng ta cần biết. Acetylcholine, dopamine, noradrenaline, serotonin, and GABA. Part 7, motor control and reflexes. The CNS integrates sensory information, generates movement. Through the upper motor neurons and lower motor neurons. Any damage to the upper motor neurons will cause spasticity or hyperreflexia. Any damage to the lower motor neurons causes flaccid paralysis, fasciculations, or atrophy. Reflex arcs allow fast autonomic responses without conscious control. Mình tìm hiểu vào các điều khiển vận động và phản xạ. Thì các vận động là sẽ do hệ thần kinh trung ương nó sẽ kiểm soát. Thần kinh trung ương nó sẽ là tích hợp những thông tin cảm giác và tạo ra vận động. Còn ra neuron vận động trên hoặc neuron vận động dưới. Và neuron vận động trên là sẽ đi xuống từ vỏ não vận động. Neuron vận động dưới sẽ kích thích trực tiếp lên cơ phân. Thì bất kỳ những cái tổn thương nào ở neuron vận động trên sẽ gây ra cái sự co cứng, tăng phản xạ. Và tổn thương của neuron vận động dưới sẽ gây ra tượng liệt mềm, cung giật bóp cơ hoặc là theo cơ. Phản xạ hoặc là cung phản xạ, hoặc tạo ra những cái đáp ứng tự động rất là nhanh mà không cần kiểm soát có ý thức. Người ta nói là phản xạ không do não điều khiển, không ý thức, unconsciously or without conscious control or without consciousness, không cần sự kiểm soát có ý thức, tạo ra những cái đáp ứng tự động rất là nhanh. Rồi mình nói về hai cái phần nhánh của hệ thần kinh tự chủ. The autonomic nervous system helps maintain homeostasis. It's subdivided into sympathetic activity and parasympathetic activity. Hệ thần kinh giao cảm hoặc là những cái hoạt động giao cảm, nó sẽ giúp làm tăng nhịp tim, giảm phế quản, huy động glucose, increases the heart rate, dilates bronchi, metabolize glucose. While the parasympathetic activities promotes digestion, increases glandular secretion, and conserves energy. Thần kinh phối giao cảm hoặc là các hoạt động phối giao cảm nó sẽ giúp kích thích cái sự tiêu hóa, tăng tiết tuyến, trữ năng lượng và bảo vệ năng lượng. Hypothalamus coordinates autonomic functions, temperature, hunger, and circadian rhythms. Circadian rhythms là cái nhịp sinh học. Thì vùng dưới đồi kiểm soát những cái chức năng về tự động, thân nhiệt, đói và những cái nhịp sinh học ngày đêm. Circadian rhythms. Hook 9 and 10 talk about the disorders or diseases related to the nervous system. Major neurological disorders. Một số những cái rối loạn hoặc những cái bệnh thần kinh chủ yếu và thường gặp. Increased intracranial pressure may result from hemorrhage, edema, infection or tumor. Sự tăng áp lực nội sọ có thể là do xuất huyết, phù nề, nhiễm trùng hoặc là khối u. Traumatic brain injury includes concussion, contusion, fracture or hematoma. Chấn thương sọ não gồm có là chấn động não, dập não, chảy xương, tụ máu. Stroke may be ischemic or hemorrhagic. Đột quỵ có thể là do thiếu máu, có thể là chia ra là thiếu máu cục bộ hoặc là do xuất huyết. Transient ischemic attack TIA is temporary but increases stroke risk. Còn thiếu máu não thoáng qua là tạm thời nó thoáng qua nhưng mà nó làm tăng lên cái nguy cơ đột quỵ. Dementia, especially Alzheimer's disease, causes progressive cognitive decline. Chứng sa sút trí tuệ, đặc biệt là Alzheimer, gây ra sự suy giảm về nhận thức, tiến triển. Parkinson's disease affects movement because of dopamine loss. Bệnh Parkinson sẽ ảnh hưởng hoặc là tác động đến sự vận động hoặc là cử động do mất dần dopamine, do sự giảm dần dopamine. Multiple sclerosis is a demyelinating autoimmune disease, bệnh tự miễn về mất và hủy myelin là xơ cứng. Peripheral neuropathy causes sensory loss, weakness, reduced reflexes. Bệnh lý về thần kinh ngoại biên gây ra sự mất cảm giác, yếu, liệt. Rồi các phản xạ giảm, hạn chế. Guillain-Barré syndrome. Guillain-Barré syndrome causes a standing quickness and a fast breathing. Hội chứng Guillain-Barré gây ra sự thiếu cơ tê liệt và ảnh hưởng đến hô hấp. Bell palsy causes unilateral facial paralysis. Liệt Bell, liệt dây thần kinh mặt ngoại biên. Liệt mặt ở hai bên. Spinal bifida and hydrocephalus. Spinal bifida, hydrocephalus, important developmental disorders. Nứt đốt sống, não thủy là những cái rối loạn tiến triển rất là quan trọng. Intracranial neoplasms present with headache, vomiting, seizures, focal deficits. Neoplasms, u nội sọ. Kèm theo là nhức đầu, ói mửa, co giật, thiếu hụt thần kinh cô trú. Part 10. Clinical evaluations and investigations. Giá và thăm khám lâm sàng. Neurological assessment begins with a careful history and physical examination. Key examinations areas contain the mental status, cranial nerves, motor strength, coordination, tone, reflexes, and sensation. Diagnostic tools include CT, MRI, lumbar puncture, EEG, nerve conduction studies, electromyography. What about the treatment? Treatment depends on the disease and include prophylaxis, phlebotomy, antimicrobials, dopaminergic drugs, immunomodulatory therapy, neurosurgery, or rehabilitation. Tùy thuộc vào tình trạng bệnh lý mà sẽ có rất là nhiều những cái cách điều trị có liên quan tới thần kinh. Mình vừa đi qua một số những cái ý chính có trong bài tập. Các anh chị xem lại nội dung cũng như những cái ý chính này để chúng ta chuẩn bị bước qua phần practice. From exercise B, bắt đầu từ task B. Page 87. A few minutes for you to prepare for the task. Ta bắt đầu làm bài từ task B. B, C, D, E. Tôi có khoảng 10 phút để chuẩn bị cho các task và sau đó ta sẽ cùng nhau sửa bài. Okay, now let's check the answers for part B. MCQs for reading comprehension. Đáp án và các dẫn chứng, các minh chứng ở trong bài để giúp mình chọn được cái câu trả lời đúng nhất. The main function of the nervous system is the maintaining homeostasis. Two, a nervous system surpasses endocrine regulation in speed and spatial specificity. Three, the two main divisions of the nervous system is central nervous system and peripheral nervous system. Four, neuronia described as supporting cells that outnumber neurons. More numerous than neurons, về số lượng vẫn nhiều hơn neuron. Five, meninges protects the central nervous system structurally. Six, damage to upper motor neurons results in spasticity and hyperreflexia. Seven, sympathetic activation causes redistribution of blood flow to muscles. Eight, progressive loss of dopaminergic neurons is the Parkinson's disease. 9. CT scanning useful for detecting hemorrhage and mass effect. And 10. Thrombolysis is mentioned for acute ischemic stroke. Okay, next is part C, the case studies. Case study 1, suspected ischemic stroke. Some vocabularies in this case study 1. Collapse, Difficulty speaking. Difficulty speaking. Quickness. Quickness. Facial droop. Facial droop. Slur speech. Slur speech. Confused. Confused. Hypertension. Hypertension. Urgent assessment. Urgent assessment. Ischemic stroke. Ischemic stroke. And CT scan. Now let's analyze the case studies 1. To underline the clinical clues for ischemic stroke, suddenly collapsing, difficulty speaking, quickness of the left side, slur speech, left facial droop, muscle quickness, and confusion. How the risk factors lead to ischemic stroke. Những yếu tố nguy cơ dẫn đến bệnh lý này là gì? The patient has hypertension and type 2 diabetes. The conditions damage the blood vessels. Poor medication adherence makes them worse. Medication adherence. Việc tuân thủ điều trị không đúng và kém làm cho tình trạng càng nặng hơn. Blood vessels in the brain becomes blocked. Blood flow stopped, so the brain cells are injured. Những yếu tố nguy cơ như là tăng huyết áp, tiểu đường loại 2, cái việc tuân thủ điều trị hoặc là dùng thuốc kém, không đúng sẽ làm cho bệnh càng ngày càng nặng hơn. Dòng máu bị tắc nghẽn, dòng máu nuôi những các tế bào não bị chặn lại, ngừng lại, khiến cho các tế bào não bị tổn thương. So here là the questions for case study 1. What is the most likely diagnosis? Acute ischemic stroke. Number 2. Diagnostic imaging study must be performed immediately. Non-contrast CT scan of the head. Urgent assessment critical or important in this condition. Urgent assessment is critical. It's very important due to its relation to the time window for treatment. Time window for treatment. Thời gian vàng để điều trị. I mean, early treatment can save the brain tissue. Bất kỳ những cái bệnh lý nào về não, đặc biệt là đột quỵ, thì nó sẽ có cái thời gian vàng để điều trị. Nếu mà qua cái thời gian đó thì xem như là nó rất là khó khăn, đúng không? Càng sớm càng tốt. Điều trị sớm có thể cứu được não, mô não. And for the treatment, what treatment? If imaging confirmed diagnosis and timing is appropriate. Nếu chẩn đoán chính xác và thời gian cũng điều trị phát hiện trong cái thời gian vàng thích hợp thì cái điều trị sẽ là gì? Intravenous thrombolysis with antiplase or mechanical thrombectomy. Now, let's go on case study 2. Probable Alzheimer's disease. Vocabulary in case 2. Increasing forgetfulness. Forgetfulness. Misplaced household items. Misplaced household items. Forget names. Repeat the same question. Visual difficulties and motor difficulties. Neurological examination. Show no quickness. Tremor. Intact reflexes. Cognitive testing. Severe impairment. Recent memory. Decreased executive function. The many can see from the case study 2 memory symptoms, including increasing forgetfulness, forgetting names, repeating the same question, or severe impairment of the recent memory. Bệnh lý ảnh hưởng về về trí nhớ, chủ yếu là bệnh trí nhớ, bệnh già, bệnh hay quên đó, Alzheimer. Ngoài ra nó còn sẽ ảnh hưởng đến những cái vấn đề sinh hoạt hàng ngày. There are some daily life problems related to the condition. Misplacing household items, needing help from the others. They cannot do or perform daily life activities by themselves. or taking medications. Và các đánh giá lâm sàng bao gồm neurological examination, cognitive testing, executive function. Đã phân tích cái case nào. 73-year-old female. She has increasing forgetfulness and memory problems. It's likely about Alzheimer's disease or dementia. She has got. What are the symptoms? Increasing forgetfulness, misplacing household items, forgetting names of family members, repeat the same question, need help remembering to eat meals or to take medications. Then the patient needs to do some tests or physical examination to make a diagnosis. The negative findings. Sleep is normal, no visual difficulties, no motor difficulties, no weakness, no trauma, intact reflexes. There is no abnormalities. Let's look over the risk factors of the case. The patient is rather old, 73 years old, is a major risk factor. The symptoms developed over the last 4 years, so the condition is chronic and progressive. The patient has progressive memory decline. Suy giảm trí nhớ tiến triển, là càng ngày càng nặng á, càng ngày càng giảm trí nhớ đó. She also has decreased executive function, and she needs help with daily activities. And now answer the question for page 2. The condition is likely Alzheimer's disease. Severe impairment of recent memories is the main symptoms, but that supports the diagnosis. Middle temporal lobes, especially the hippocampus, is most affected in this disease. MRI or CT of the brain is very useful to exclude other structural brain abnormalities. Test study 3. Suspected Guillain-Barré syndrome. Some vocabulary related to the presenting symptoms of this syndrome: a rapidly progressive weakness in both legs, difficulty standing, tingling sensations. History includes mild respiratory infection, fever, sore throat, resolved without treatment. Lịch sử bệnh lý bệnh nhân. Examination findings: lower limbs, marked quickness, reduced deep tendon reflexes, vital signs: mild tachycardia, negative findings: no bowel or bladder dysfunction, cranial nerve exam is normal. So the patient presents with rapidly progressive weakness in both legs. He had a mild respiratory infection 1 week earlier. On examination, the lower limbs show marked weakness. Deep tendon reflexes are reduced. The patient reports tingling sensations in the feet. There's no bowel or bladder dysfunction, and the doctor is concerned about the further progression. How to analyze the case? A 25-year-old male. He has a progressive fetish in both legs, and he may have a neurological disorder. The symptoms based on the clinical examinations are rapidly progressive weakness, difficulty standing, tingling sensations, reduced reflexes, normal cranial nerves, no bowel dysfunction or bladder dysfunction. Những cái dấu hiệu và triệu chứng lâm sàng để mình chẩn đoán bệnh đó. Recent respiratory infection, rapid progression, ascending weakness, reduced reflexes. So the patient is most likely to suffer from Guillain-Barré syndrome. Tất cả những cái dấu hiệu triệu chứng thông qua việc thăm khám lâm sàng cho thấy là bệnh nhân có nhiều khả năng là mắc hội chứng Guillain-Barré. So now answer the questions. Page 3. Right, the most probable diagnosis for this situation is the Guillain-Barré syndrome, or GBS. Peripheral nervous system, especially peripheral nerves and the myelin sheaths, primarily affected in this situation. Three, doctors or clinicians should monitor for respiratory failure due to paralysis or respiratory muscles that can potentially lead to fatal complications. Các bác sĩ phải đặc biệt lưu ý tới cái biến chứng rất là nguy hiểm là suy hô hấp do liệt các cơ hô hấp. To help confirm the condition, we have a lumbar puncture and nerve conduction studies or electromyography. Đây, thoát đi. Nên chị check đáp án mình ta xem các gợi ý ý nghĩa của các câu hỏi. From 6 to 8. Nine to 11. Eleven, dry ride or false. Nếp cuộn hoặc nếp gấp của não. False or dry ride. Đặt phân biệt những cái từ là gyrus, gyride, circus, circi, and fissure. Nếp gấp hoặc hồi não, rồi rãnh não và khe não. Một số những cái từ chuyên môn để diễn tả những cái chi tiết ở trên não. From 12 to 14. From 16 to 18. Nineteen and 20. Let's move to part E. Parkinson's disease. What questions? Okay. Parkinson's disease, question 1 to 5. And here's the answer. Giao dịch mình có thể học không ha? Giao dịch mình có thể học không ha? Question 6 to 10. Okay, part F. Use of English tool. The synonyms. 4 to 6. Seven to 10. Now, question. Correct the mistakes. So let's check your answers. Allowing communication between the tissues. Động từ phụ ở dạng verb in hoặc verb ed nếu mà nghĩa chủ động hoặc bị động. Động từ chính là transmit. Thì allow động từ phụ nằm trong mệnh đề cũ thôi. So, enabling by preposition verb in by doing something sau với từ by verb in. 3. Responses số ít hơn. Response immediate response. 4. Coordinate động từ chia cho chủ từ số ít. Cerebellum coordinates. 5. Cấu trúc song song các danh từ heart rate, digestion and secretion. 6. Description due to noun phrase. Due to description of the sentence. 7. Cấu trúc song song nói hai động từ and provide neuralier, provide and protect neurons. 8. Giống như câu số 1, động từ phụ có động từ chính là circulate. Là động từ phụ protecting the nervous tissue. 9. Entire body. Tính từ đứng trước và bộ nghĩa cho danh từ, miêu tả cho danh từ. The entire body, toàn bộ cơ thể. 10. Có mệnh đề thì động từ sẽ chia ra dựa vào cái nhóm danh từ ở phía trước. Neurotransmitters which bind to receptors. Còn nếu mà rút gọn là neurotransmitters binding to the receptors. Có which là nó sẽ là mệnh đề, cần phải chia động từ ra vào danh từ trước nó. Còn nếu rút gọn là bỏ which luôn. Right, let's touch. Alzheimer's disease and cognitive decline. The gap filling. Right. From question 1 to 5. Question 6 to 10. Then that's all for the test. For part 1, reading for the nervous system. Are there any questions for this part? Okay, for this part, make sure you understand the vocabularies or the main idea and details of the reading passage related to the nervous system. Do the exercises again and again. Make sure that you are memorize all the vocabularies or the structures and well prepared for the next section skills in the next lessons. Okay, we can stop now if you have no questions. Review the lessons and prepare for the next one. Okay, bye-bye class. Goodbye and good night. See you next time.
Right, teacher.